Hello and welcome to our PowerPoint presentation on policy challenge of requiring mandatory empanelment of nurse practitioners by all Medicaid HMOs and third-party insurance companies. This is by Rose Tattle, Tyshell Wilkinson, and Rita Ostendorp. This is our signature assignment. Table of contents, this is what we are going to be discussing. We're going to be talking about our group's policy challenge, our interview with our registered nurse leader in the association that he belongs to. We're going to elaborate on empanelment. We're going to elaborate on the agenda for our empanelment, how the FLANP, the Florida Association of Nurse Practitioners, chose mandatory empanelment, different strategies that they use to inform or lobby legislators regarding mandatory empanelment, non-legislative strategies used to support mandatory empanelment, where it is right now in the legislative process, and how if and when it is made mandatory, how it's going to affect the future. So, policy challenge. So we are talking about mandatory empanelment. It is our policy challenge. Empanelment is one of the steps that allows patients to be seen by a provider. If a patient has a specific insurance, if the NP is not recognized by that insurance provider, then the patient cannot see the provider. They won't cover it. They'll have to pay out of pocket or not see them at all. So empanelment, it refers to assigning patients to the provider of care, which is actually the NP. They support, deliver ongoing and continuous care, coordinates with the team, and assumes responsibilities to provide comprehensive, patient-centered panel care. So they have a panel of patients. This is our nurse leader that we interviewed. His name is Stan Whitaker. He is the Government Affairs Chair of the Florida Association of Nurse Practitioners. We discussed with him all the stuff that we were going to, be elaborating on, such as our agenda, the empanelment, how the policy challenge was identified by the FLANP, who's going to be affected by empanelment when it becomes mandatory, strategies that they've used to inform and lobby the legislators, non-legislative strategies that were utilized to support this initiative, where the policy challenge is now in the legislative process, and how empanelment becoming mandatory will affect the future. So, agenda for empanelment. There are many different agendas behind the policy challenge of mandatory empanelment of nurse practitioners. So one of the things is mandatory empanelment ensures a continuity of patient care, and it creates a bond between the patient and the provider. It enhances prevention of illnesses through education and interventions. So in one study that was completed in California, 3 federally qualified community health centers, they were lacking in quality of care. Patients, they received fragmented health care, and the patients were seen by many different providers due to provider availability. So they would only see these physicians because of the fact that they were first come, first serve. So these patients, they weren't able to establish a sound relationship with the provider, and the provider workload made it where they cannot spend enough time with the patient and provide education. So this lack of continuity resulted in the provider not knowing what the other provider that is taking care of the patient had already done, and most of the time, the majority of the time, they were sitting there trying to figure out what had been done already. So it wasn't good for the patient. So how FLANP identified the issue of empanelment. So they identified this issue because insurance companies not wanting to empanel nurse practitioners they saw that through extensive research and of current literature and experience, regarding empanelment issues in their own daily process. So they expanding mandatory empanelment of the nurse practitioner, it could resolve ongoing physician shortages in the United States. So in 2010, our group, the FLAMP, they conversated with state legislators regarding this policy. And ever since then, they've been, the payment system of the private, the public sectors, and the other insurance companies, they've been trying to advocate since then, trying to get this taken care of. So we've, he's witnessed, Mr. Whittaker, he had said that he had witnessed in his own experience that, nurses not being able to be impaneled in an insurance company due to fine print prevented them, from being impaneled. And because of this, patients that were in underserved communities such as rural or urban areas, they were left without a provider. So it was a big issue for patients. They weren't able to have care that they truly needed because they weren't able to see a nurse practitioner. So who is affected by mandatory empanelment? So there's 3 people that are affected by mandatory empanelment. This is the patient, nurse practitioners, and physicians. So with empanelment that is mandatory, patients are able to receive quality care. They have more access to providers, as we talked about, have continuity of care. Nurse practitioners, they are not as restricted to who they can provide care to. They're able to make a difference in patients' lives. And physicians have a reduction in, patient workload. So pretty much the patient, I was researching patients, the average physician has like a panel size about 2,300 patients. It's pretty detrimental to patient care. And the physician would have to work 22 hours out of a 24-hour period to be able to take care of all those patients. We can't do everything for the patient, so they need help. So who can affect mandatory empanelment? Many people can affect this. Lobbying with nursing associations and educating people, such as the public physician groups. They can, such as the Florida Medical Association of Florida Patient Protection Coalition, they can affect this as well. I read a lot of things where these physician organizations were talking about things that weren't, correct. They were very incorrect, so we need to challenge them. So FLMP, strategies to inform lobby. So their motto is displayed at the top of their page. They advocate. So they inform and lobby lawmakers by advocating for their patients. This is completed by collaborating with other corporate, governmental, and non-governmental and professional organizations. Non-legislative strategies, pretty much what it is the FLAMP, they will challenge new legislative rules or policies that come up that are deemed incorrect. They'll read all the fine print and figure it out. So Mr. Stan Whittaker said, the rules that determine how the law is interpreted is the biggest area to make the fastest change in. So where it is right now in the legislative process. So right now, at the moment, MPs are allowed to be impaneled, but there's fine print. So for instance, certain healthcare places, insurance companies allow only people that have privileges at certain hospitals to be impaneled. So that's pretty much it. They're trying to change it to any willing provider, which is good. That's what they're trying to do. They're trying to advocate for that. So this is a message from our group. So the legislative process for the rights of the NP is ongoing. We as NPs, they're the nursing associations, will always be fighting for patients' rights to exceptional health care. We actually implore you to become politically active through local and national NP associations. So we need to educate the public. So here's our references. And you guys have a blessed day.